Hi, I'm Rob. I am one of the ENT registrars in the Oxford Deanery, and I am here to talk to you about flexible nasal endoscopy, specifically the anatomy on flexible nasal endoscopy. So let's get started. The first thing I'd like us to get an idea of is the anatomy as you enter the nasal cavity. It's always important to orientate yourself and get your bearings. So as you can see here, I've gone into the right nasal cavity and I have a view of the nasal septum here on my right and the inferior turbinate on my left, and you can actually see the middle turbinate just poking out at us superiorly. So this allows me to see where I am and to see where I want to go. And I often think at this point, what is the best way to get to where I want to get? And very often this is achieved by going into the inferior cavity, which is what I do now. So I go down into the inferior meatus and I go underneath the inferior turbinate, and I try to go all the way straight down to the back whilst lying underneath the inferior turbinate. An alternative is to go via the middle meatus, which I attempt to do here as I go above my inferior turbinate and try to go underneath the middle turbinate and pass into the middle meatus, whereby I will have the right maxillary sinus to my left. Sometimes you can see an accessory ostium at this point, and you can often use this cavity to go all the way down to the back. However, for the purposes of this demonstration, we're going to pass through the inferior meatus, passing underneath the inferior turbinate, whereby straight ahead we are able to see our nasopharynx, and on the patient's right, our left, we can see the right eustachian tube, and this is a good area to note any obstructing lesions, and we'll cover such things in the pathology part. Sometimes I like to also have a look at the contralateral eustachian tube, which is quite doable by a simple rotation movement of the scope, remembering that it is a 360 degree instrument. You can then pass into the pharynx. Here we have the posterior pharyngeal wall posteriorly and our epiglottis straight ahead, and the tongue base just in front of it there. By a simple maneuver of asking the patient to stick their tongue forward, you can look at the follicula. Here we can identify the posterior aspect of the left tonsil. However, unfortunately, it is not so easy to see the posterior aspect of the right tonsil here. We then proceed beyond the epiglottis, where we obtain a good view of the supraglottis, looking here at the right and left arytenoids. And this also allows you to visualize the aryepiglottic folds, left and right respectively. It's important to have a good view of these, as they can sometimes be inflamed during illnesses such as supraglottis. You then have the opportunity to look into the patient's piriform sinuses as you go laterally with your scope, and you can see the left piriform sinus here, and it's important to have a good look around, particularly throughout the mucosa, and then go around to the other side to try and have a look into the right piriform fossa. It's important to look at these as they are the entrances to the esophagus and sometimes harbor small mucosal lesions. You can then assess vocal cord movement, trying to see the entire length of the vocal cord, assessing for symmetry of movement by asking the patient to count to 10, as well as to hold the note E as long as they can whilst you assess the length of the vocal cord. You can also get a glimpse of the subglottis and see if there are any narrowings there. For completion, we will look at the anatomy of the glottis, identifying the left vocal cord here, looking for lesions along its length, similarly the right vocal cord. and you can see that just in front of it you can see the anterior commissure as well as the left and right false chords. Thank you for watching our short session on flexible nasal endoscopy anatomy. We hope it has been useful and helpful for you.